My Uncle Phil has boundless energy. He
does. He really does.
Kids everywhere. He has animals. He has his patients. He has everything, and it doesn't seem like he ever runs out of energy.
No, he's always been an enthusiastic person, and he always did a lot in the community from the time he was in grammar school. And he chose to be a doctor, and he married a very nice girl, and she's a good mother.
Fortunately for him, he shares the personality of his mother.
Oh.
He was the favorite.
He is the prince, and it's a good thing.
He's the only boy, he's the youngest child. Of course he's the favorite. He is the prince, but he's a nice prince.
I think my grandfather's a very thoughtful person, very compassionate, always thinking of others, is really just willing to drop everything to help someone out.
I've been very lucky to have him as the role model. He won't say it, but I know for a fact he did a lot of charity care, not because it was forced upon him, because he wanted to do it. When I was in second grade, he and our whole family went to Tunisia, Africa, where he worked on the ship Hope, which was a hospital ship.
Doc was his best man in his wedding, and right away I knew what a great relationship they had. And looking at Doc to know what type of man Phil will grow up to be, or has grown up to be, has grown up to become.
Dr. Sheridan Sr. and his family, and particularly he and his wife, have been phenomenal supporters of Stritch. In addition to being a graduate of Stritch, he has continued to be very active, and in the early years it was absolutely necessary because the school was very financially challenged and came close to going out of business, if you will, as a school due to financial challenges.
Catholic medical education is getting to be more and more important in this country, and Loyola is doing a good job.
I can't say enough about Loyola. It's a great family. Medicine would not have a lot of the difficulties it's having if the model for care and the model for camaraderie amongst physicians and healthcare providers that Loyola has was the model for care.
Phil is an internist with a subspecialty in pulmonary diseases. Probably the largest pulmonary disease is bronchial asthma. He noted to me one day that it was a big problem in Chicago.
To imagine this, the size of his family, his immediate family and extended family, plus his commitments to the hospital, to decide, I'm going to start up a nonprofit, and not a small one. We launched the first clinic out in the field in November of 1999, and so that was one van. We were running it at 5 schools, and now there are 3.
All kids are the same anywhere. They want to be healthy and happy, and they deserve the same care as we want for our own children.
Phil Jr. has so many things going on, so many, family obligations and different offices that he's working at and treating patients. But if we needed a physician to fill in on one of the asthma vans, would be the first to volunteer and the first down there.
Certainly what we're doing at Mobile Care is great, and it's just kind of an extension of what he's done over the years.
He's putting himself down too much. There wouldn't be any Mobile Care if it wasn't for him.
When the time came for us to decide who should be the medal winners this year, and we talked about Phil Sr. and Phil Jr., the obvious answer, it needed to be both of them. It's father like son and son like father.
I think it's such an honor that they're receiving it together. And they've done such wonderful things for the asthma van and for Loyola. And I just think the fact that they're receiving it together is so special. I know for my husband, because his dad definitely is his hero.